The prediction of a Wits University-designed algorithm that shows South Africa is at a low risk of a third COVID-19 wave has not allayed fears, because health experts say they are concerned. Since the first COVID-19 case was recorded in March last year, the country experienced two waves, the second deadlier than the first. So could the third wave be worse than the second? And of course that seems to have been the experience across the world. I'm joined now by Professor Sheetal Silal from UCT. She's Director of the Modelling and Simulation Hub Africa. Prof, thank you so much for your time. So we've seen this across the world. It seems that the waves almost get worse. Do you think that's going to happen here in South Africa?
I think, as with the rest of the world, it does depend on what is driving these waves. Now, in South Africa, we've had a different experience from the rest of the world, and the second wave being due to a variant of concern. And it really matters now what will be the cause or the primary cause of our third wave. And there could be many such causes. If you like, we can go through them in a little bit of detail.
Yes, just give me very briefly, because we've only got a few minutes and I've got heaps of questions for you.
Indeed. So we've got to think about, could it be due to behavior change, NPI, fatigue, population getting tired over time? That could have a different impact on a third wave, as opposed to another new variant of concern, which could itself be more deadly. It could be due to seasonality, it could be due to waning immunity. But the bottom line is that we need to be monitoring these different factors as they are manifesting in our population in order to understand what might be causing.
So you keep a close eye on what the numbers are doing. I know before Easter there wasn't really any pattern on any upward trajectory, that we still seem to be bubbling under, as I like to see it. We were worried about Easter, that people would not stick to those protocols. Is it too early to see whether any Easter misbehavior on those protocols has had an impact?
Yes, it is too early right now. We are about 10 days from the Easter break. I think the next 2 weeks will be critical in order to understand if we are starting to see increases in cases in little pockets around the country, and how fast we can respond to those increases, and whether they might altogether lead to a start of a greater increase or a new wave.
The WHO has signalled their concern. They're saying that the pandemic is reaching a tipping point, infections spreading rapidly. In the last week, 4.4 million cases reported. It is the 7th consecutive week of rising numbers. In terms of us versus the world, South Africa's sort of been a little bit behind the progress or the trajectory of the rest of the world. Does that also signal that we are heading for an increase a few months down the line, or is it impossible to draw those conclusions at this point?
I think it is impossible to draw those conclusions, or even to say that South Africa is a little behind. While there are some countries like Spain anticipating their fourth wave, there are also some countries who are actually only entering their second wave now, who've had a very large first wave. I think India might be an example of that. So I think each country has its own characteristics and its waves driven at different times by different factors. And so it's important to look at the local context.
Sure. We are expecting an address from the Health Minister around 7 o'clock this evening. We're very aware that in the United States there's now concern, Food and Drug Administration, a temporary pause on the Johnson & Johnson vaccine. It seems it may have similar problems to the AstraZeneca vaccine. We know, and we must stress, there is no proven link yet between a very rare blood clot disorder and these vaccines, but there's significant concern and perhaps not enough data to see some of the authorities hitting pause. In the UK, they have looked at the risks. They've seen that the risks of dying of COVID-19 in the elderly is something like 6%, but in young people under 25, I think it was 0.01%. So they've said young people don't get AstraZeneca because it might just have an issue. But it's a risk versus benefit. If you look at that with the current data that we have, knowing that it's not yet a clear link between these vaccines and this very rare blood clot disorder, do you think there's enough justification here in South Africa to press the pause button on the Johnson & Johnson rollout?
I think it's a very important decision, one that does take a lot of discussion and information. So for starters, with the report coming out of the FDA today, there's still another meeting happening with the CDC or the external advisory group still. And so I think we do need to wait for that external advisory group to have a formal statement. And then it will really come down to a decision between the various ministerial advisory committees on vaccines, weighing up all of this information together to make an informed decision.
I want to speak to you about the risks, because you look at the numbers, and of course, with the vaccine hesitancy and a very strong anti-vaccination lobby, any health concern around a vaccination causes massive concern and a lot of anger. But what do we know about the actual real safety risks around these vaccines, and how real those safety concerns are and how big they should be?
I think that what we know is that it is a learning process, that as we are rolling out our vaccines and we have different risk groups in the country, we are monitoring closely and keeping abreast with what's going on in the rest of the world. And so we are learning as the vaccines are being rolled out. Yes, there are risks to vaccines for certain subgroups of people, as there are for all vaccines, and we know that there is a very large benefit to vaccines. I think that the scientific evidence needs to be weighed up to decide at which stage the benefits outweigh the risks or the risks outweigh the benefits, and perhaps a strategic approach can be taken. I think it's important above all to be transparent and to make sure that the public is aware at all times as to what the real risks are and as to what perhaps exaggerated or unsubstantiated risks might be.
Oh, thank you.
Our evening panel will be about this too.
Absolutely. Thank you very much for your time. That was Professor Sheetal Silal. She is Director of the Modelling and Simulation Hub Africa at the University of Cape Town.